Hey everyone, welcome to the Pawareness podcast, and thanks for joining me. Be sure to rate, review, and subscribe on iTunes, Spotify, and YouTube, and also check us out at pawareness.org and on Instagram at pawareness_official. On Instagram, we are doing submissions for Pet of the Week, where you can submit your foster pet, and we'll pick one winner every month, and we'll give $200 to their choice of charity or foster. Thanks for watching, and I hope you enjoy this episode. Hey everyone, welcome to today's episode. Today I have Tannetje Crocker, Dr. Crocker Pet Vet, with me today, and I'm really excited to have her on. I'm going to go ahead and let her introduce herself, what she's got going on, and we'll take it from there.
Hello, Chris. Thank you for having me on. I am Dr. Tannetje Crocker. I'm a veterinarian. I practice in Texas. I do general practice with dogs and cats, and then I work at an ER where we see everything pretty much except for large animals. So wildlife, exotics, dogs and cats. And I love what I do. I came across your podcast. I thought it was really cool, and the education aspect of it and just talking about different things in the animal industry. So we came up with some fun topics, and I'm excited to jump in today. I think it'll be fun.
Yeah, I think it will too, especially for any pet owners out here. This is cool because we get to talk with a professional that does this every single day. So I'm going to go ahead and dive right in. Okay, so one of the topics I wanted to talk about today was just properly medicating cats and dogs. And we don't have to keep it directly to cats and dogs. I know that you, like you said, you deal with some exotic animals as well, but that's kind of what we talked about. So in terms of that topic, it's a pretty big topic. Actually, you know what? I want to rewind a little bit before we get into that. I want to know like a little bit about you, like, right? So like, I think that's really important with your story and your context. Like, can you talk with, I've done my research, but I want you to share with us like kind of your background and how did this passion for you start? And then we'll get into that.
Kind of the typical, I was 5 years old, I loved horses and I loved science. And so I kind of went the veterinarian route, and I did horses actually only for 4 years, and then kind of segued into small animal when I started having a family and needed to reduce hours a little bit. But I've been out in practice for 11 years, and I really love what I do. I've done a lot of different things. And as social media stuff started growing, I would have a lot of other veterinary professionals that would be sharing their stories and sometimes hearing a lot of negativity. And I felt like, especially for like vet students and newer grads, that was probably really disheartening to hear people say that they were struggling so much and they were having a really hard time in the profession. And my experience has been one that I've kind of made decisions and ended up in places that I still really love it. And I have great clients. And I think that there's things we can do as veterinarians to maybe find that joy again. So started on social media about 1.5 years ago, just to share my journey. And it kind of blew up and it was really fun. And I've connected with tons of people that are in the pet industry, but also veterinary professionals. And my ultimate goal is just to connect and like move everything in a positive direction. I think part of that is maybe educating owners a little bit on our side of things and our struggles and kind of pulling back the curtain a little bit. I think a lot of people worry about their pets and they go to the vet, but they don't always think about like who the vet is and what they're experiencing, what they're dealing with. So I wanted to come on and talk to you just because you have a passion for animals and especially rescues. And I think that's awesome. And we came up with some great topics, and I just like sharing what I do. I really do love it and love talking about it. So
yeah, and I think you're definitely, like you said, that passion shows. And having, it's so crazy what you can do with social media and the good it can have when, and like you said, you're just like, I'm just going to put this out here. And then it kind of just took on a life of its own. And that's always amazing to see. So to get back to what we were originally talking about is one of the topics I wanted to talk about was properly medicating cats and dogs. I know that you talked a little bit about this on your Instagram. And what are some things that you see? I mean, there's so many different things I want to talk about here, but what does that mean, right? When you're talking about properly medicating cats and dogs, when do you want to do this? What are some common misconceptions you see? And we can kind of go from there.
So I think from our perspective as veterinarians, your pet comes in, we diagnose them, and we know what we need to do for the pet, right? But the really important part is, if I give you 5 medications, can you even get those in your pet? And I think a lot of owners are scared to maybe say, no, I can't do that, or that's too much, or based on my lifestyle, like I can't give medication 3 times a day. And I think being open and honest and having the conversations to say, can you pill your cat? Can you give this? Do we need to try injectable medications instead? So what I always try to tell my clients is, these are my recommendations. Now, do you think you can do this? Because they've shown that compliance with cat medications, especially long-term medications for like thyroid cats or diabetics, it's like 30%. And 30% is not good enough. Like we should do better. And I don't really think it's always on the owner. I think that as veterinarians, we also have to say, we know how to fix your animal, but we need to know what you're able to do at home. And if you can't do that, we need to think creatively. There is a ton of injectables that you can use. There is a ton of compounding pharmacies that can make things into like yummy chewables or flavored liquids. There's a lot of transdermal medications that they've come out with for pets. And so I think that we have to think outside of the box, but we need like really good communication. And that's what I stress in practice. That's what I stress to new grads coming out. Like, you know what to do, but if the owner can't give them medication, is completely worthless.
So when you say 30%, what exactly is statistic referring to? And secondly, I want to say is, what are some reasons why a pet owner couldn't medicate their animal that you're talking about, that problem there? Like, what are some things that you normally see?
So the main conditions, like in cats, thyroid issues, they need daily medication usually for that, unless they get their thyroid zapped and irradiated, which is a big procedure. Sometimes if they have cancer, they need daily medications, chemo medications, or steroids. Kidney cats, they need a lot of support and oral medications, fluids under the skin sometimes to maintain hydration. And then you have diabetics that need insulin injections twice a day. There's a lot of treatments for pets, which is great, right? We've developed all these medications and all these things for them. But when you're asking people to schedule and give something every day, that's hard sometimes for owners. So the statistic I'm referring to is cats that were seizure patients. They were only getting their medication 30% of the time, because I love my cat. My cat is wonderful. My cat hates it if I do something he doesn't want to do. And I think that that's kind of cats in general. So unless you have the best cat in the world, shoving a pill down their throat twice a day is not really going to be that easy for a lot of owners. And so it's having that conversation, because especially something like seizures, if they don't get the medication, they're not going to have therapeutic levels, and they're going to continue to seizure. So they've actually been researching transdermal seizure medications for cats. And like I said, a lot of people will make those into chewables or liquids that are maybe easier to give. But I would say pet stubbornness or like aggression is the main reason why people can't give medications. And then secondary to that is just lifestyle. I'm really busy. It'd be hard for me to have a diabetic and give insulin exactly on the dot every 12 hours, and be really regimented, which is what they really need. Does that make sense?
Yeah, that makes perfect sense. And what are some remedies for that, right? Like, I mean, not everyone, like you said, a lot of people are busy. So what do you do for those people that can't give their cat that medicine every 12 hours? How does that work?
So it's really keeping the lines of communication open, where you'll say, okay, your pet really needs this. We're going to try it this way. But if it's not working or you're not getting it in your pet, you need to call us. You need to let us know, because there's other maybe formulations that we can try, or maybe there's a once a day medication instead of a twice a day medication, or maybe they're doing okay on every other day. So the big thing that pet owners need to do is circle back to their veterinarian and say, this is or isn't working, and give them a chance to try something different. If I don't see you for 6 months, I'm assuming everything's going great and you're giving the medicine. And then if you come in and I say, how's it going? And they're like, oh, well, it's not great. And we seizure once a week, and, they're not eating well. And I'm like, I didn't know that. I assumed no news was good news. So it's really for pet owners contacting them. And I do think vets are busy. So sending an email is great, and really laying out the struggle you're having and where you're at and what you're dealing with, and giving them time to maybe think of other options. If you call and say, I need to talk to the vet about this medication, usually they're not going to be able to just stop in the middle of the day and do that. So using other forms of communication, especially right now during COVID, when we're all really swamped and overwhelmed, I think would be ideal. But it's really just keeping lines of communication open and trying different things, and realizing there's going to be limitations. And if there's limitations, you probably will not get that pet 100%. But even if you improve their quality of life 80%, that's still better than where you were.
Yeah, and I think you made a good point too about the communication. Like, when you have it via email, you can sit down, you can think about it, maybe really process it and give it probably a better answer, or along like problem solution along those lines, as opposed to you just get called on the spot, middle of the day, busy. No, I think that's important. I think that's really good. You said you're in Texas. are you primarily dealing then with animals that are in your area, or do you get animals like shipped to you? How does that whole like supply chain work?
So really in the South, we are the ones who have a ton of rescue animals, and we have the shelters that are really full, and we're shipping animals like up north and to the east. So we're the ones that are usually sending animals elsewhere, which is amazing because I like that there's other options. The only bad thing is the spread of disease. So if you have a pet in Texas, they're going to be more likely to be exposed to heartworms if they're a dog. And then if you ship them somewhere else and they get adopted, potentially there wasn't heartworms in that area, and now you have a heartworm positive dog. That's kind of how lepto spread too. Lepto is a bacterial disease that's found in the environment. And California used to not really have that disease in pets. And then so many pets were shipped from the South to California. And now lepto is more prevalent in California. So it's great. You just have to realize if your rescue you're dealing with brings dogs in from elsewhere, there might be some other diseases and considerations that aren't found locally where you are. And so it's just important that the pets are worked up in a certain way and they're checked for all these things that maybe you never had to consider before if you're a vet up north and you don't have heartworms in your area.
And why is the South usually the one that's doing the shipping out? Is it like the weather there, or like the warm weather, or what is that like?
So I think we have an overabundance pet population in general, and it's so warm here that pets can live outside really easily. It doesn't get that cold. Even if they have babies, it's not going to get that cold where the babies don't make it. The babies are going to do great and thrive, which is good, but it contributes to pet population issues. And we have a ton of great, I have so many clients that adopt rescues and love them. And really with COVID, the shelters have been really clearing out a lot because everyone's getting pets, right? Which is great. But it's also hard because COVID's not allowing people to socialize their pets. And so we're seeing some more behavioral issues and things like that we wouldn't normally see when people adopt new pets or puppies and kittens. So we're having to kind of be creative about ways to socialize safely during COVID. But we do have a pet overpopulation issue here. And I do think it has to do with the weather more than anything else, and just how much land and spread out everything is. Animals can run free and no one ever really knows about it,
No, that makes perfect sense. Yeah, I had to ask that. Always interested about the logistics behind things. Now, I want to talk with you about, obviously there's a lot of people who listen to this are just passionate about animals in general and giving back. And I know that you kind of alluded this earlier on about advice for vets, but I mean, with your experience, do you have any advice for anyone listening that might be a vet that wants to be, that is aspiring to be a vet? Do you have a piece of advice for them about obviously you're extremely passionate about what you do, so that has to be there, but what else, can you give these people?
So I think it's important to know that people who are veterinarians do love animals, but it is not always an easy job, because sometimes you love the animals and you care for them, but you can't help them. You have to, put animals to sleep, which is a really difficult thing. You're dealing with, financial constraints with owners and trying to keep a business going and trying to balance, those two things. You're having to deliver really bad news. I had to tell someone the other day that their cat was dying, and this was this man's cat, that his wife who passed away, it was her cat, and it was like the only connection he still had to his wife. And I basically had to tell him that, it was the cat's time, and he was just devastated. And honestly, I don't think he likes the cat that much, but it was the connection to his wife. And so it's a lot more than just loving animals. It's really caring for people, being good at communicating. And I think some people enter the profession because they just love animals, and you slowly get worn out if you're dealing with owners who maybe don't even care as much as you do, or blame you for things that are out of your control. And so it does take a certain personality to kind of set up boundaries and know who you are and know that you are doing it. And even if you have, one difficult interaction, there's 20 good ones in a day, but certain personalities are going to dwell on the bad interaction versus focusing on the good. And I think those people are the ones that really struggle in our industry. I wish I could help everybody and do everything all the time for everyone, but we have to keep the lights on, we have to pay our staff. And so it is a balance. And we have great clients that trust us, and I really don't deal with a lot of that sort of issue, but I know a lot of vets do. So I would tell anybody entering the profession, I don't like people, I like pets, and I want to become a veterinarian. You have to deal with people, and you have to kind of have a thick skin, and you have to have a passion that keeps you going because of the pets, but people are a part of it.
Wow, that's great. I mean, what about though, like that outlet, right? I mean, like, how do you, obviously, like dealing with a lot of like, heavy things that you're having to deal with, like, how do you channel that? Do you just have like, do you have like a particular hobby or something that you like doing, or activity that's like your outlet or something along those lines? Like, how do you, because like you said, I mean, it's one bad thing, 20 good things could happen, but certain people are going to dwell on that one bad thing. Like, how do you get past that? Is it just experience, or?
I do think a part of it's experience. Part of it is learning that, almost training yourself to be grateful. And this is shown to work, like for mindset in general, every day, like writing down 3 to 5 things you're grateful for. And it can literally be, I'm grateful I woke up, I'm grateful I'm healthy, I'm grateful I had a cup of coffee. I mean, it can be simple things to start out with, but really training yourself to focus on the positive. And then I just have a great support system. I have other veterinarians I can reach out to who really get it. My husband is amazing support. I come home, and if I'm just really needing to have a moment, he takes the kids, and I get that. And spending time with my kids and being outside and, being active, those are all really, really important to me. You have to compartmentalize, and that is tricky. Like in a day, or even in a 40-minute time span, I can go euthanize that sweet kitten for that guy who's crying in the room, right? And I'm like trying to hold it together. I come out of that room, I look up what is going on with the next patient. I have about 30 seconds, and I walk into a new puppy room, and I have to say, oh my gosh, look at your new puppy. I'm so excited for you. Tell me the story. Where'd you get him from? And so you go from extreme heartbreak to excitement, and you have to be able to like turn it on and off. And then when I get home is when I can really like take a deep breath. And that is a skill as you get farther in practice that you learn to develop as you get throughout the day. And it's a survival skill, in my opinion, but you do get better at it. And I do have some times where I walk in and an owner's like, hey, Dr. Crocker, especially if I know them well, they're like, how are you doing? And I'm like, I'm making it, like I'm honest about, it's a tough day today. So I don't hide it, but I also know the new puppy owner, I don't want to put that on them. That's not their thing, their burden they need to bear. So it is learning to be resilient. It's learning to focus on the positive and having a support system. Those would be the 3 big things that I think really help you get through the day and enjoy your day still and feel like you're making a difference.
Yeah. I mean, like you said, I think the survival skill part, it's definitely just to, like you said, to make it. And I can speak about the gratitude thing. I mean, I've been doing that since early 2019, writing down 3 to 5 things. And sometimes they're really small. Like sometimes it's like I am grateful for my sense of smell or something. And then, or and then other times it's like, family members or friends or something. But these things, I think focusing, like you said, there's actually like proof behind that show like gratitude does help with happiness and overall. So no, I think that's amazing advice. And not only for if you want to be a vet, but like any career.
Well, and like 2020, right? Like everyone.
And 2020.
2020 just beat you down.
Exactly. Like everything, support system, gratitude, compartmentalizing and exactly. Okay, no, that's great. Now, I know that we talked about this, like kind of switching gears a little bit. You see a lot of pet owners. You see across different spectrums. You probably see so many issues. So this is kind of a bigger question, but what advice do you have for pet owners in terms of based on like common misconceptions you see, that you could be doing or, with their pets? And I'm curious as well, because I have a cat and I have a dog that I watch as well. So I'm wondering is there anything I'm doing myself that maybe I shouldn't be doing? So yeah, interested to hear what you have to say about that.
So from the veterinary standpoint, I would tell you that doing like your routine wellness stuff and getting into your vet just routinely is really important, because especially cats are so good at hiding disease, and they will hide very, very significant disease, and you will not know it until they are like really sick and dying. So I think the preventative visits, the wellness visits where you go and you're like, they're fine, we don't need to go, but like, go get that exam, have the conversation about what you're feeding, how the litter box use is doing, like what sort of environmental stimulation are you doing? Let them put their hands on your pet, check their weight. Like weight loss is a huge indicator of disease in pets long before you will see any other signs. And so, and doing the routine lab work, like those things will make your pet's life longer and better if you do them. And there's, wellness plans, there's insurance plans that you can do that will pay for pretty much all of that I think is well worth it. I think having pet insurance is great and awesome and really, really important because big things happen and they always seem to happen at the wrong time. And you don't want to be caught not being able to take care of it, for your pet. With behavioral stuff, I really think the sooner you engage a really certified professional trainer, if you're having some issues with aggression or fear aggression or food aggression, the sooner you employ somebody to help you with that, and maybe in combination with your vet to maybe do some anti-anxiety medication or something to help with training, the sooner you jump on it, the better and quicker it'll improve. I have a lot of owners that will call me and say, the dog is, tearing everything up, or the two housemates got in a fight, and I'll quickly try to get them to have somebody do a home visit and do a behavioral assessment and people keep putting it off. And then all of a sudden you have one of the dogs come in and it's torn the other dog's neck open, and it was like the third time. And so I think behavioral things, the faster you address it, and you can start with your vet, but sometimes they're going to get somebody else involved, the quicker it will resolve. That's really, really important. I don't really care. I know we're not going to really go down the food road, but I don't really care what you're feeding your pet as long as they're healthy.
I was actually going to ask that. Yeah.
I don't harp on food as long as they're healthy, it's well balanced, and your pet looks good and doesn't have any issues. Okay. I'm going to get really into diet if your pet has an underlying condition like kidney disease, like liver disease, like heart disease, diabetes, where I really need them to be on a specific diet. And I don't even care if you home cook for your pet, as long as you have all the vitamins, minerals, and nutrients in there. And there's so many resources now where you can really get good recipes and, good ideas on that. So I don't harp on food or really go into food that much with owners, as long as their pet's healthy and doing great. My dog, she eats all our scraps. Like, she's 15. She eats everything off our table. You know what I mean? Like, I spoil the heck out of her. So I don't know. I think there's certain things that are really important to focus on, and food is something people feel very strongly about. And as long as your pet's growing, looks good, and is healthy, then feed them what you want. And if something comes up, then we'll have to address it.
Okay, no, that makes sense. Now, I do have a few questions. My first question is how often, like, I know I get it for people, but for animals, right? What's the frequency of that routine checkup? Is it like yearly, like once a year, once every other year, or more than that? I don't know.
Usually the recommendation, like in our practice, if they're less than 7 years old, it's once a year. And so it's a wellness. And most dogs are going to have like some sort of yearly vaccine, like a Bordetella vaccine or lepto in our area. Those are yearly vaccines. So it's kind of when you need your heartworm test done and your vaccines done, that's your yearly exam. And we just do a thorough checkup. We always offer lab work at that time, and it's like a reduced rate because we're trying to encourage people to do preventative care. And if you catch things on lab work before you see clinical signs, like before they're vomiting, not eating, you can sometimes, turn things around. Pets over 7, especially cats and especially like smaller dogs, we try to see them every 6 months if possible. I've had pets over 7 that I haven't seen for 4 months, and they come in with a ruptured tumor in their belly, and we did an ultrasound like 4 months before. So I have seen things really quickly progress and happen, and owners are always like, what happened? So there's always a better chance of catching those things if you see them more frequently. We still only, in my practice, recommend blood work once a year, but it just lets us examine the teeth, see if any heart murmurs have developed, and then check the weight, especially on the cats, to make sure. And the cat thing, like our cat vaccines are every 3 years after kitten boosters, because we don't want to give more injections than we need to. But I still like to see my cats frequently because heart murmurs, thyroid issues, kidney issues, all that can be picked up on pretty quickly with a thorough history and exam.
Okay, no, so, that's great. That's great.
So every 6 months over 7, once a year under 7.
If you're listening, take notes. Like Take notes, write it down.
There you go.
That's amazing. Okay. Oh yeah. My next question was you mentioned behavioral training, right? So my direct question is, are there some insurance plans that cover that at all? Like even if you pay like a premium or I don't know how.
That's a really good question, and I am not sure on that. I know Nationwide has a good pet insurance plan. Trupanion has a good one. Most of them are usually medical costs, so they would cover if there was like an anti-anxiety medication that needed to be given or something to kind of do a sedative every once in a while. They would probably cover those things. I don't know about the training side of things. Now, there's trainers and then there's veterinary behaviorists. And I would think if you went to a veterinary behaviorist or you consulted with them, that would probably be covered because that's like a veterinary visit. So, yeah. But I don't know just about any trainer. And I still would recommend people contact like their vet and get trainer recommendations because a bad trainer is almost worse than no trainer, right? Like if you have somebody who uses aggressive to with. So I would definitely get input into who to use locally, especially if you're like new to an area and you're not sure.
I think that's even like with anything, right? Like I'm learning bad habits and like that's essentially what would be happening is and sometimes that's like, then you have to unprogram that. And then like, so I didn't even think to ask that, but that's a good point of advice. Consult a vet before you go down the training route. And it's probably more likely to be covered on insurance if you do go through your vet. So yeah, that's really
like
good.
If you write on the exam, recommend training. Yeah,
exactly. Oh, I'm probably going to make some calls about that too. Like, and just ask around and see if that's under any umbrella of any insurance plan. Okay.
And then you need to email me and tell me. So I know.
And then I'll tell you, and then you can just spread the advice.
The word.
That's what I love doing. I love researching. That to me is like the most fun thing. So yeah, let's see here. I guess, to kind of wrap things up here. Okay, so how can people get a hold of you? Where can people find you at? What's the best way to do that? Go ahead and let us know all of your social media.
All the things. So dr.tannecie.crocker is my Instagram. I'm most active on there if you want to like see videos of things throughout the day, see my pets, see my clients, see my kids. And then I put cases on there. And it's really fun because even non-veterinarians will like chime in on the cases and say, we have no clue, but we think this. And like, it's kind of fun to see like what owners think. And that's probably the number one place I interact and connect. Now I have a website where everything is, and it connects to my YouTube and my Facebook page. And that is just drcrockerpetvet.com. So that's a place you can go and you can kind of get to anywhere. You can email me, you can subscribe. And occasionally I do giveaways, or I just, will say where I'm speaking or what I'm going to be at next. And so it's just a fun way to kind of keep track of what I have going on. And you asked about people who want to become veterinarians. I actually created like a veterinary career guide, and it's a fun little workbook, like a choose your own adventure for different types of veterinary careers. And I think it's kind of a cool thing to give the kids that are like in high school or in college and thinking about it. And that you can get to that through my website too. And I think if you use Dr. Crocker 30, you get like a 30% off, but it's just a PDF. So you can download it on, an iPad. But it's got quizzes in there and it's got fun little things about different types of practice and just some information because I got so many questions about it constantly. And I was answering the same questions over and over and finally was like, let me just create something that answers these questions. And now I can like refer people to that.
That's amazing. And I was actually going to ask you, I'm like, do you have like any workshop or anything like that? So that's amazing that you do have something to offer. If you're getting the question all the time, you might as well offer that out. And links to everything you said, including that, will be in the description below of whatever medium you're listening on, whether it's, Spotify, YouTube, Stitcher, whatever it is, it will be there for you. So it's, to download. And once again, I want to thank you so much for coming on. I learned a ton. I know my listeners learned a ton. So thank you so much. And definitely great having you on.
Thank you for having me. And if you get feedback and people have more questions that they want to ask a veterinarian, I would be happy to come back. We can chat again. We had other ideas too.
We had like this was just, it was like this much, like this much.
Yeah. But
awesome.
It was really fun and I appreciate it. Thank you for having me on.
I appreciate it too. All right. Well, thank you so much and see you guys next time.